Question number 1. Which of the following is the most appropriate initial intervention for a patient with suspected septic shock? Right answer is option B. Administering IV fluids. Question number 2. A nurse is caring for a patient with increased intracranial pressure. Which position is best for the patient? Right answer is option C. Head of bed elevated 30 degrees. Question number 3. What is the best indicator of effective fluid resuscitation in a patient with hypovolemic shock? The right answer is option B. Increased urine output. Question number 4. Which symptom is the earliest indicator of malignant hyperthermia? The right answer is option A. Muscle rigidity. Question number 5. A patient with a chest tube has continuous bubbling in the water seal chamber. What does this indicate? The right answer is option B. Ear leak. Question number 6. Which medication require monitoring of INR levels? The right answer is option B. Warfarin. Question number 7. Which electrolyte imbalance is a common side effect of loop diuretics? The right answer is option B. Hypokalemia. Question number 8. A patient on digoxin present with nausea, vomiting, and visual disturbance. What should the nurse do first? The right answer is option A. Check the digoxin level. Question number 9. A patient receiving morphine for pain control develop respiratory depression. What is the antidote? The right answer is option B. Naloxone. Question number 10. Which class of antihypertensive drug should be avoided in pregnancy? The right answer is option B. ACE inhibitors. Question number 11. Which rhythm requires immediate defibrillation? The right answer is option B. Ventricular fibrillation. Question number 12. What is the primary treatment for symptomatic bradycardia? The right answer is option B. atropine. Question number 13. A nurse is caring for a patient in DKA. Which IV fluid should be started first? The right answer is option B. Normal saline. Question number 14. Which ABG result is consistent with metabolic acidosis? The right answer is option B. PH7 CO2 40 HCO3 Question number 15. A patient with heart failure is prescribed furosemide. What should the nurse monitor? The right answer is option B. Potassium level. Question number 16. Which leadership style is most effective in emergency situation? The right answer is option B. Autocratic. Question number 17. What is the primary goal of quality improvement QI in nursing? The right answer is option C. Improve patient outcomes. Question number 18. Which strategy best reduce medication errors? The right answer is option A. Double checking high alert medication. Question number 19. What is the best way to handle a conflict between two nurses? The right answer is option B. Encourage open communication. Question number 20. Which act protects patient privacy and health information? The right answer is option A. HIVAA. Question number 21. What is the term for a nurse making a decision on behalf of patient without consent? The right answer is option C. Paternalism. Question number 22. A patient refuses treatment but the nurse administers it anyway. This is an example of. The right answer is option B. Battery. Question number 23. A nurse witnesses a colleague administer the wrong medication and does not report it. This is an example of. The right answer is option B. Professional misconduct. Question number 24. Which document outline a patient wishes for end of life care? The right answer is option C. Advance Directive. Question number 25. Which ethical principle requires nurses to tell the truth to patient? The right answer is option B. Veracity. Question number 26. Which condition is associated with pulses paradoxes? The right answer is option B. Cardiac tamponade. Question number 27. Which laboratory value is most indicative of acute kidney injury? The right answer is option B. Increased serum creatinine. Question number 28. A patient with chronic obstructive pulmonary disease COPD is at risk for. The right answer is option B. Respiratory acidosis. Question number 29. Which electrolyte imbalance is commonly seen in tumor lysis syndrome? The right answer is option B. Hyperkalemia. Question number 30. Which diagnostic test is most useful for confirming pulmonary embolism? The right answer is option C. CT pulmonary angiography. Question number 31. The priority intervention for a patient with anaphylactic shock is. The right answer is option C. Administering epinephrine. Question number 32. In advanced cardiac life support, ACL is the first line drug for asystole is. The right answer is option B. Epinephrine. Question number 33. Which action should the nurse take when performing defibrillation? The right answer is option A. Ensure all staff are clear of the patient. Question number 34. What is the correct chest compression depth for an adult in CPR? The right answer is option C. 3 inches. Question number 35. A patient with attention Pneumothorax will likely exhibit. The right answer is option B, tracheal deviation. Question number 36. A postpartum patient with preeclampsia is receiving magnesium sulfate. What is the priority assessment? The right answer is option B, deep tendon reflexes. Question number 37. Which pedal heart rate pattern indicate in umbilical cord compression? The right answer is option C, variable declaration. Question number 38. Which pregnancy related condition require immediate delivery? The right answer is option B and C, preeclampsia and eclampsia. Question number 39. A patient with gestational diabetes should be monitored for. The right answer is option A, hypoglycemia in the newborn. Question number 40. What is the priority nursing action for a patient experiencing postpartum hemorrhage? The right answer is option B, administer IV oxytocin. Question number 41. The most reliable sign of dehydration in an infant is. The right answer is option B, dry lips. Question number 42. Which childhood illness require airborne precaution? The right answer is option B, measles. Question number 43. A child with Kawasaki disease is at risk for. The right answer is option A, cardiomyopathy. Question number 44. What is the priority nursing action for a child with epiglottis? The right answer is option C, keep the child calm. Question number 45. The most common causes of bronchiolitis in infant is. The right answer is option B, respiratory syncytial virus. Question number 46. A common early sign of Alzheimer's disease is. The right answer is option B, short-term memory loss. Question number 47. Which of the following is a primary risk factor for osteoporosis? The right answer is option B, sedentary lifestyle. Question number 48. The best pain management option for an elderly patient with osteoarthritis is. Elderly. The right answer is option C, acetaminophen. Question number 49. The Beers criteria is used to. The right answer is option B, identify high risk medication for older adults. Question number 50. A nurse is caring for a patient with Parkinson disease. What symptoms require immediate intervention? The right answer is option D, difficulty swallowing. Question number 51. Which neurotransmitter imbalance is most associated with schizophrenia? The right answer is option B, high dopamine. Question number 52. Which intervention is most appropriate for a patient experiencing a panic attack? The right answer is option A, encourage deep breathing. Question number 53. A nurse suspected serotonin syndrome and a patient taking SSRIs, which symptoms support this diagnosis? The right answer is option B, muscle rigidity. Question number 54. A patient with bipolar disorder is prescribed lithium. What is the most important instruction? The right answer is option B, maintain adequate hydration. Question number 55. Which disorder is best treated with cognitive behavioral therapy? The right answer is option B, borderline personality disorder. Question number 56. A patient with Clostridium difficile should be placed on which precaution? The right answer is option B, contact. Question number 57. What is the most effective way to prevent the spread of hospital-acquired infection? The right answer is option B, using hand hygiene before and after patient contact. Question number 58. Which type of isolation is required for a patient with tuberculosis? The right answer is option C, airborne precaution. Question number 59. Which condition is a major complication of untreated streptococcal pharyngitis? The right answer is option A, glomerulonephritis. Question number 60. A patient with AIDS develop oral thrush. Which medication is commonly prescribed? The right answer is option D, fluconazole. Question number 61. What is the nurse priority before administering perioperative sedation? The right answer is option D, assessing for allergies. Question number 62. A patient undergoing surgery is at greatest risk for? The right answer is option B, hypothermia. Question number 63. Which assessment finding requires immediate intervention in the post anesthesia care unit? The right answer is option B, oxygen saturation. Question number 64. A patient with a history of malignant hyperthermia should avoid which anesthetic agent? The right answer is option succinylcholine. Question number 65. After surgery, which finding is most concerning? The right answer is option B, urine output of 20 ml per hour. Question number 66. A patient with a spinal cord injury at T6 is at risk for? The right answer is option B, autonomic dysreflexia. Question number 67. Which is of priority nursing intervention for a patient with a stroke? The right answer is option C, assesses airway and breathing. Question number 68. The first sign of increased intracranial pressure is usually? The right answer is option B, altered mental status. Question number 69. A patient with multiple sclerosis is most likely to experience? The right answer is option A, muscle weakness and fatigue. Question number 70. Which cranial nerve is affected in Bell's play? Bell palsy. The right answer is option B, cranial nerve 7. Question number 71. A patient with Addison disease is at risk for? The right answer is option B, hypoglycemia. Question number 72. What is the priority nursing intervention for a patient in thyroid stroke? The right answer is option B. Reduce body temperature. Question number 73. Which laboratory result is expected in a patient with diabetic ketoacidosis? The right answer is option C. High ketones. Question number 74. Which finding indicate that insulin therapy is effective in a patient with diabetes? The right answer is option B. Hemoglobin. Question number 75. A patient with Cushing syndrome will likely is exhibit. The right answer is option B. Moon phase in central obesity. Question number 76. A patient with chronic kidney disease should avoid food high in. The right answer is option A and B. Potassium and sodium. Question number 77. Which of the following is a sign of hyperkalemia? The right answer is option A. Muscle weakness. Question number 78. The best indicator of kidneys function is. The right answer is option C. Serum creatinine. Question number 79. A nurse is caring for a patient undergoing hemodialysis. What should be monitored? The right answer is option A. Potassium level. Question number 80. A patient with nephrotic syndrome is at increased risk for. The right answer is option A and B. Infection and hypertension. Question number 81. A patient with COPD should receive oxygen 8. The right answer is option A. 1 to 2 liters per minute. Question number 82. What is the primary treatment for status asthmaticus? The right answer is option B. Bronchodilator. Question number 83. A nurse hear crackle in a patient lung. This is most indicative of. The right answer is option A. Pneumonia. Question number 84. Which symptom is most concerning in a patient with a pulmonary embolism? The right answer is option D. Hypotension. Question number 85. Which test confirm the diagnosis of tuberculosis? The most appropriate answer is sputum culture. Question number 86. What is the highest level of evidence in research? The right answer is option C. Randomized controlled trial. Question number 87. Which research design is best for studying cause and effective relationship? The right answer is option C. Experimental study. Question number 88. In evidence-based practice, what does PICU stand for? The right answer is option A. Patient Intervention Compression Outcomes. Question number 89. A systematic review include. The right answer is option B. A summary of multiple studies. Question number 90. The purpose of informed consent is to. The right answer is option A. Ensure patient autonomy. Question number 91. Which ECG change is most indicative of myocardial infarction? The right answer is option B, ST elevation. Question number 92. A patient with atrial fibrillation is at increased risk for. The right answer is option B, stroke. Question number 93. The best way to evaluate fluid status in a patient with heart failure is by. The right answer is option A, checking daily weight. Question number 94. Which medication is commonly used to treat symptomatic bradycardia? The right answer is option A, atropine. Question number 95. What is the primary purpose of pacemaker? The right answer is option A, regulate heart rate. Question number 96. A patient undergoing chemotherapy is at greatest risk for. The right answer is option B, neutropenia. Question number 97. Which symptom is most concerning in a patient receiving radiation therapy? The right answer is option A, fatigue. Question number 98. Which screening test is most effective for early detection of cervical cancer? The right answer is option B, pap smear. Question number 99. A patient with leukemia is placed on neutropenic precaution. What intervention is most appropriate? The right answer is option B, limit visitor and ensure hand hygiene. Question number 100. Which tumor marker is most associated with prostate cancer? The right answer is option C, PSA.